Hello, welcome back to this second day of the International Conference on Climate Emergency and Health. We had a short break or a longer break with our poets, and now we're back for a thematic session. Willem van der Put from the Institute for Tropical Medicine in Belgium was there already. He came back now to moderate our next session, and the session will be on transformative communities with 4 partners. He will do a session. So Willem, I think you hear me, you can start.
Hey, thank you very much. Good afternoon to everybody and welcome to this session, and especially good afternoon to our presenters who are in view. We have 3 short introductions of those people present, and what we thought to do is to introduce each of you by showing your presentation, by sharing your presentation. All those presentations will be quite short, 5-6 minutes, something like that. And after that, we will have a kind of a panel discussion where we also have opportunity to react to your reactions. So let's start with women-led climate justice. This is a project of international organization called I'm so sorry, I lost Nicolette. What was the name again? Horrible.
It's called IPADS. We're an international NGO called IPADS.
Yes. IPAD, and the 2 projects that you will present us about, one is in Mozambique, one is in Bangladesh. I think very interesting. The presentation will actually be done by Jorge Martine, if I pronounce his name right. So I would say let's start and look at the presentation. Thank you.
Good day. I'm so pleased to be here with you to talk about this important topic, women-led climate justice. I'm Dr. Martini from IPADS Mozambique. I'm here with my colleague, Nicolette van der Sen, the IPADS representative for Europe. For those of you who may not know, IPADS is an international NGO. We work on 18 countries in Africa, Asia, and Latin America to expand access to abortion and contraception, powered by our commitment to human rights and reproductive justice. Welcome to this presentation. At IPADS, we believe that women-led climate justice and reproductive justice is central to global development and stability. As climate emergency become frequent, we will see a stronger link between those environmental pressure and gender-based violence, crop failure, lack of income, school closure, and generally a threat to women and girls' well-being, health, and safety. We know in times of disasters, women and girls need reproductive health care more than ever, but it's often unavailable or neglected. Many of you may have seen the Lancet 2021 Climate and Health Report, a first step as it addresses gender, but doesn't really include the impact on reproductive health, or the draft of WHO COP26 special report, which doesn't incorporate gender or sexual reproductive rights. So today, we will talk about the impact and effects of climate has on reproductive and maternal health, and ensure that adaptation plans, local actions, and women needs are included. At IPADS, we believe that women-led climate justice and reproductive justice is essential to global development and stability. Climate change is one of the defining crises of our time, and people's sexual and reproductive health and rights are affected by this crisis. Numbers don't lie. When Cyclone Idai hit Mozambique in 2019, 1.8 million people were affected, including around 488,000 women in reproductive age were also affected. Women comprise 20 million of the 26 million people estimated to have been displaced by climate change. And the majority of the 1.5 billion people living on $1 a day or less are women. There are also more than 1.8 billion young people in the world today, and they are living the reality of climate change. Young people, particularly girls, are most vulnerable to the many effects of climate change, as well as the effects of lack of access to sexual and reproductive health and rights. At IPES, several years ago, we began to look at the impact of climate change on women's reproductive health and decision-making. We began talking with women in coastal Bangladesh and Beira in Mozambique, two countries that experience most severe impacts of climate change in the world. Mozambique, one of the world's poor countries and my home, is highly vulnerable to climate change. We experienced a devastating cyclone in March 2019, and we are still feeling the impact. Climate change has exacerbated poverty and poor health outcomes for rural coastal population. In coastal Bangladesh, in areas around Dhaka, like the massive Rohingya refugee camps, frequent cyclones, landslides, and flooding also make this country particularly vulnerable to climate change. In our case studies, we have two components: a qualitative research piece conducted in coastal Bangladesh, as well in 3 districts of the Zambezi province in Mozambique, and a communication piece which shows the impact of climate change on sexual and reproductive rights through image, stories, and the voice of women. What we have learned from our case study? We learned that climate change denies women's power. Women and girls are often responsible for gathering food and water. In a landscape already altered by climate change, a longer walk to water or a new food source can make them more vulnerable to rape and subsequent unwanted pregnancy. Crop failure due to drought can mean a family cannot afford contraception or safe abortion. A family facing severe hunger may sacrifice the young doctor for transnational sex or early forced marriage. Women in humanitarian setting caused by climate disaster are often exposed to rape, harassment, discrimination, and violence, and have limited access to reproductive health care. The effects of climate change and pollution and stress have a negative impact on women's health. They see it, they feel it, and they know the effect on their bodies. Many women say the pollution in the air or in the water causes them pain and menstrual issues. Some feel certain that these issues lead to early menstruation, which can lead to early marriage and early sexual relations, which can add to the negative impacts on women's and girls' lives.
হ্যাঁ, আমার মনে হয়, আমার জানা মতে আমার শ্যামনগর থানার ভিতরে হাজার 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 মহিলা এরকম আক্রান্ত। হ্যাঁ।
Here is Noor Banu, 20 years, lives with her parents and young doctor on Shandi, Muka, Bangladesh. Without adequate access to healthcare and education, Noor says, girls face a lot of problems here, especially related to pregnancy. Families can't afford to go to the doctor, and as a result, young women sometimes die during childbirth and from abortion performed in unsafe conditions or by untrained providers. Her elder sister tried to end an unwanted pregnancy secretly and was sick for weeks before the family could take her to the hospital. Noor doesn't want her doctor to suffer as she has, and she knows what it will take to improve things. And she said, if the girls get any education institute and a hospital, that could help them greatly. Here's Laura Tranquiamandi, lives in Beira. She lost the roof of her house during Cyclone Ida. Since then, she and her husband have struggled to provide for their 2 children. She wants to delay having another child until she can find better work and provide for her family.
Non posso lasciare nei segretti quindi per una pausa. Consigli un po' di mio figlio.
So many women we have talked with in Mozambique have said the same thing. They speak of the stress of caring for their families, trying to find work, continuing schooling, or keeping their children in school. All of this has an impact on their ability to control their own reproductive health. As climate emergencies become more frequent, we will see a stronger link between this environmental pressure and gender-based violence, crop failure, lack of income, school closure, and general threat to women and girls' well-being, health, and safety. We know in terms of disaster, women and girls need reproductive health care more than ever, but it's often unavailable. Around the world, we tend to think about glaciers melting, or polar bears, or plastic choking sea life when we think about the impact of climate change. But we know it affects real people every day. It affects every aspect of their lives, particularly women, who are the cornerstone of African families. We see it when kids can't go to school because of flooding. Little girls lose out on opportunity. We see it when women can't farm and sell their product at the market because of drought. People's health suffers. People's security and safety is in jeopardy. In our research, women are telling us what they experience and what they need to live and to thrive. They want access to healthcare, including to reproductive healthcare, like contraception and abortion. Those health services are not the solution to the climate crisis, but women are telling us that it is what they need to adapt to the change and stress around them. With this service, they are better able to finish their education, achieve economic stability, and to be the decision makers about their own bodies. They are building their own resilience. We have a responsibility to listen to them and to help create resilience, community, and health systems around them. Thank you.
Presentation. There are immediately, thank you, there are lots of questions popping up, of course, but let's save them until we have introduced our next 2 speakers. But thank you so much, Jorge. It was truly interesting. Now I would like to introduce Rhoda Dalang from the Philippines, and she will talk about indigenous populations and the climate change and how it affects them. Okay, Rhoda, the floor is yours. Welcome.
Mine is a natural adaptive recourse of indigenous peoples in dealing with limited access to health services, especially in times of emergencies brought about by climate change. For indigenous peoples, the material condition for our primordial resilience to the impact of climate change, including that of health, is our possession of our natural resources in our ancestral territories. Indigenous peoples who continue to inhabit their mountain territories, like us in the Cordillera region and elsewhere in the world, remain in control of our agroecological food systems, our natural resources, and our ancestral territories. Such prevailing control over our food systems and the factors nourishing these are the bedrock of our primordial resilience, both in terms of food as well as health resilience, whether in time of emergencies or normal situations. the nutritionally diverse diet provides us the nutrition needed in building our resilience to diseases and malnutrition. At varying levels, indigenous peoples remain in control of their indigenous knowledge and practices on primary health care, acknowledged as a collective legacy, thereby being practiced as a collective societal responsibility. The prevailing indigenous social value on community welfare is vital in shaping the collective effort of community resilience as we deal with the impact of climate change, whether in the aspect of health, food, and other social determinants. These indigenous knowledge and practices form the building block of our community-based health program, or CBHP. Our CBHP intervention have been reinforcing these indigenous practices by increasing our indigenous knowledge with scientific enlightenment, improving sanitation practices such as fencing off of otherwise freely roaming pigs, construction of community toilets, organizing backyard gardening and other forms of preservation of herbal medicine, introduction of traditional Chinese medicine as complement to indigenous reflexology system, introduction of basic mental health care as complement to indigenous practices, and other basic practices on primary health care. In addition, the CBHP program made its contribution in the collective effort of indigenous peoples in claiming for equal right to the highest attainable standard of health. The particular contribution of our CBHP has been the facilitation of linkages of indigenous communities with health service providers, with the academe, with health advocates, locally, nationally, and internationally, such as sharing our story in this very important international conference. Thank you for bringing us in. Moreover, the struggle to practice our own developed community-based health program and the struggle to demand for right to health has from the onset been linked to the struggle of indigenous peoples for the right to ancestral land and right to self-determination. Sad to say that this community-based health program has been among the targets of the Philippine government's counterinsurgency program, having been tenaciously tagged as communist program or communist linked. Persecuting our CBHPs will not terminate the well-ingrained social movement for the defense of ancestral land, which is the foundation of the resilience of indigenous peoples in dealing with emergencies such as health emergencies brought about by climate change. The ultimate factor that will obliterate our primordial resilience to climate change and its health impact is by uprooting us from our territories or introducing large-scale projects that will result to loss of control on our natural resources or by intense militarization of our territories, factors which we are intensely resisting against. Thank you.
Thank you. Thank you very much, Rhoda. This is a touching presentation that combines the traditional values with the modern politics. Interesting to talk about later on. But first, we will have our third and last presentation. And that comes from closer from where we are at this moment, or at least some of us in Brussels. And that is Vitalia. Vitalia Povilatite, if I pronounce this right, will talk to us about a garden project in Brussels, and it's about co-creation urban healing spaces. Vitalia, we are looking forward to your presentation. The floor is yours.
Good afternoon, everyone. I am Vitalia Pietri, a pharmacist and scientific collaborator at Mons University in Belgium, exploring nature's contributions to human health and well-being. Today, I would like to present our community-led project called Brussels Health Gardens, which I initiated with some colleagues almost 3 years ago. The Brussels Health Gardens project took root at the Museum of Medicinal Plants and Pharmacy of Université Libre de Bruxelles in early 2019. We aim to transform University Museum into a participatory, collective learning space where the knowledge about medicinal plants and nature-based health practices could interact and be shared. Our initial energy and enthusiasm manifested as a reaction to the perceived alienation from the natural world. Numerous residents of Brussels joined the project with their personal stories and lived experiences with urban nature, medicinal plants, and healing spaces. Participants brought into sharing circles their reflections how urban nature affects their health. COVID-19 triggered more specific questions. How, in times of crisis and beyond, people are taking self-care in and with nature. What nature-based health practices, places, and plants they are exploring to restore own health in times of crisis. During our co-creation journey, we organized a series of open forums, workshops, science cafes, working groups, conferences, and meetings, inviting local people from different professions and various paths of life to share their experiences with medicinal plants and traditional, or as we call it, folk common knowledge on health and nature in Brussels. We met at various venues such as university lecture theaters, museums, cultural organizations, local community centers, libraries, and of course in urban farms and gardens where various medicinal plants grow. We had moments of celebration, and then we experienced in second year a lockdown. During lockdown, we continued our work online and supported each other in virtual circles. Over a longer period of time, we realized that Brussels Health Gardens became community transcontextual learning spaces where all types of life experiences are being shared and interact, resulting into a new collective knowledge that touches deeply our individual and collective curiosity and needs. Since last September, we engaged into more reflective work on our 2 years journey. We see that our community work is shifting from human-centered towards coexistence with other species. If initially we have been questioning how we can take care of our human health using local natural resources, now we are turning into deeper explorations. What we as humans can learn from the rest of life, especially from plants, which we wish to preserve and create healing relationship with. We realize that our community work forms rhizomatic relationships with humans and modern human beings. We are constantly changing as individuals and as a collective in the front of societal challenges and multiple global crises, such as climate change, biodiversity loss, or others. And we are in constant becoming with plants and other beings, with whom we wish to connect through our rituals and stories, listening to all voices and including them into sharing circles. One of the methods we are exploring right now is writing with plants as a new way of being and becoming with them. In this slide, you can see Brussels rhizomatic city observed in one of our health gardens, where we spend a lot of time. The mycelium of fungus is decomposing the wood of composting box, and we managed to see in it the city as rhizomes. In our health gardens project, we realized that small gardens of Brussels are interdependent and interconnected, forming Brussels as rhizomes. When we as humans move in those interconnected spaces, we are being and becoming with plants by primarily creating relational experiences with ourselves, local communities, and plant companions. We feel in the process and flow of rerouting traditional health knowledge in the city, and we feel that we are becoming more alive, resilient, and healthy through these exploration processes. I would like to finish my presentation with this picture and some open questions. As it has become more dense and we are losing constantly green spaces, can we root on beton and still remain healthy? Could we grow and find sustainable solutions with plants, and how? What at this moment we as humans could learn from the rest of life about remaining healthy and creating health in the cities? I thank you very much for presentation, and I will be glad to join following discussion.
Okay, Vitalia, thank you very much. We have, it's nice if we can see each other, if we talk together. So thank you for opening the cameras. And am I right, Marguerite? I see that we are with 17 participants. Is that correct? Or are more people looking at us from a distance? Well, whatever hey, there's Jorge. People are on the platform. Oh, great. Wonderful. Thank you for those wonderful presentations. What I have heard is, most of all, because that's also the subject of this unit, I hear how communities can be transformative by just acting, doing things bottom up rather than waiting for rules, regulations, and laws coming top down to them. And that is what I like very much. I think when change is actually taken seriously and it's created in the communities, I think there's a lot we can learn. Now, I would really encourage you all to participate as much as possible when we have this kind of panel discussion, but I would like to start off by asking some questions. Oh, for some reason my video goes off, sorry. When I hear about tradition, about culture, about the way that women think about the climate, I think it's interesting to hear from, for example, Jorge or Nicolette, from your projects. It seems that there is a special relationship, or at least a special way of talking about what climate does to women. Is there something that you could tell us about? Is there a special language or terminology that people use? Who can I give the floor? Nicolette or Jorge?
From the research, you could say there's a lot of contest around the perception on climate events. People who we could say the experience of climate events, it's so often in the last 10 years, they have a different way of understanding it. They adapted to those conditions, but also in the regions where you have other issues that exacerbate with climate events. And say, example, there's a lot of regions where you have a conflict, land grabbing issues. You will find this the climate change has been linked, or climate event have been linked as something that is been created to remove people from the land. They will, because they know they've been for many years on these social tensions with individuals who want the land. So the perception will be different. The way how they will interpret the climate events. So you will have other regions where women, example, the regions or communities that are the most affected by climate change, they're communities that they live in the basin of the rivers, example, or on the poor urban areas where normally no one wants to live there, because the conditions are very poor. So the women, because they don't have enough, doesn't have an income, they will be able to buy those kind of land. So it seems that when with the climate events, women start to not feel safe anywhere. We don't have money to live on a very safe areas, but now we live in areas that are very poor with no condition. Even that place, you know, we need to be careful. Example, one of the example statement from the research was the woman saying, you know, I live here, but I can't buy anything that is I have, because I have to carry with me, and it's so heavy that every second week when it's raining or something, I have to move my kids from my house. So it's better just we live with the clothes that we have, and we don't have to, you know, buy things to make sure that we have a better condition where they live. So you could see that the perception will go depends on the context and the way how the women really understand those events. But what do we know from the research that yes, the impact is real.
Thank you. And I mean, the obvious question that comes to me is, this must ring a bell with you also, Rhoda. If you think about the connection between those people that are at, let's say, the losing end of globalization, of climate change, those who have to carry the burden of those things that are happening. I heard you also speak from your experience in the Philippines about about how people are at the same time looking for traditional strength and fighting modernization at the same time. Is that correct? Or?
Yeah. So it is through reinforcing the community values that people are strengthened to take health on their own hands and to look into external factors that are impacting on their source of resilience. So anything that impacts on their natural environment, which is their source of natural resilience, is something that will really impact on their communities. So it's something that they will defend.
Yeah.
Thank you.
Yes.
Back to you.
Okay, thank you. And in both your experience, both, well, let's say from Mozambique to Bangladesh to the Philippines, what I find very interesting is this relationship between working on your strength, the community strength, but also the strength of traditional knowledge that has been in the community for a long time, and to mobilize that strength while you also have to confront those political forces that are endangering your survival. Would you like to react to that?
Maybe, you know, one of the things I think around this is that, you know, it's if we understand the communities, right, and we see how people get displaced, and we see it especially in Mozambique and Bangladesh, I think, you know, they're pushed to different areas, and it means that their communities also change. So the social fabric changes as well. And we know that, for example, health outcomes are very much related to relationships people have, the social fabric they have, what support they can have from the community. So we see a lot of the communities change due to climate change because they are displaced, or they go to areas which are really hard to reach because they can't get the good land anymore, because that's claimed by, you know, people like George was talking about, like land grabbing that's happening. And as we hear a lot of women, when they talk about health, they talk about their relationship with nature. So due to climate change, you see that also changing. So what's their relationship with nature? How do they redefine that? And I think, like, and of course we know that there's the traditional knowledge that people depend on, but it's also then how is that traditional knowledge then shared again when the social fabric changes? So there's a lot of change happening, and it gives a lot of opportunity, but it's also thinking how can we then adapt our health system and thinking around how to support people in these places. Yeah. Thank you.
Thank you. Vitalia, that makes me think of your presentation. If you, I mean, you come from a different direction, so to speak. In Brussels, you were, your point of entry is very interesting. How to create a more interesting experience at a museum surrounding. But then where you move towards to is actually a way of sharing knowledge that is quite different from the usual way of sharing knowledge. And that's what I hear that's important in the other two settings too. Can you say more about this?
Yes, thank you very much. Hello, everyone. I think we are all exposed to this monocultural processes that one dominating global knowledge is taking a lot of space, and Other systems of knowledge are dying and disappearing, like we see biodiversity loss, but we see also loss of languages and of small cultures that indeed are very resilient and has this long cultural roots. And therefore, I think in creating spaces to foster and share these different knowledges and to transmit these knowledges is really crucial in our days. And as Rhoda said, building this resilience, which would not rely on one system, is really essential. So I think it also applies in Belgium and other European countries. We really created systems that rely on conventional medicine and on our healthcare, but we see also the huge fragility of the system. Like with COVID, we saw that in the beginning, we've been exposed to situations when we didn't have disinfectants, we didn't have masks because we are completely dependent on global market. Therefore, building this small systems that would diversify our existing healthcare system, we find very important.
Yeah, and I think what I get from the three different stories, and they sound very different, the setting is very different, but there is, I think, more in common than what is separating. And please react and correct me if I'm wrong. Also, everybody listening, the audience, your questions are also very welcome, of course, and you can put them in the chat box. What I hear you say, all three, is that if you look at what is happening now, if you see these big global changes and you see the reaction to it that comes from, let's say, global demonstration, we all talk about like the world is one and there is it. At the same time, if we want to survive, if we want to find alternative ways of knowledge and we want to continue the traditions that have kept us alive for so many years, then it's the community where you find them. Is that correct? It's the communities that become active are, I think, the best antidote towards politicization that doesn't relate to what people experience on the ground. Rhoda, in the Philippines, for example, how is the relationship between, on the one hand, part of your presentation shows you as political activists, other parts show you as defenders of traditional medicine. Is there what about the link between those two? Is there opposition or is it the same thing?
Of course, there is an interface of indigenous knowledge and supported, as I said, by scientific education. So we also, what is being built in the communities are basic health system, primary health care and building of health resilience. We also need the services of more modern medicine to treat higher level of sickness and other health related what do you call this sickness. So we are relating our community-based health program is linked with health service providers in the urban centers and the provincial centers, where doctors and nurses, volunteers are also going to the communities, teaching people on more science-based sanitation, control of diseases. So them being doctors and nurses, that trust, that community trust is there, so they can easily their inputs are more, the people are more receptive as they are experts in modern medicine and modern health systems. So there is that interface that we are building in the communities. But what is really widely being accepted also by the communities is the traditional Chinese medicine. That one, the acupuncture, use of beads, concept of yin and yang. These are widely being used, and people are so receptive of using this. So both this traditional Chinese medicine and their indigenous knowledge really are inciting interest and stimulating interest from younger generation to carry on this indigenous knowledge and this traditional knowledge. And then you have doctors and nurses teaching them of more scientific foundation of their already learned of their indigenous knowledge. So the interface is being built in the entire process of exchanges with various sources of knowledge. Thank you.
Yeah. No, thank you. Thank you. I think indeed, if you look at the reality of life from the community perspective, all those things are there. There is traditional medicine, there is modern medicine, there are schools based on modern education, and there is traditional knowledge. It's more when people look at the outside in, that depending on what their job or their organization wants to focus on, it's like that is a specific separate part of the community. But I think, you know, in normal life, everything is available and you use whatever you can use to improve your life. So on the one hand, I see that in all your cases, there is a lot of use of traditional ways of sharing things, whether it's medical knowledge, it's healing knowledge, or it is sharing knowledge. And Vitalia, maybe you want to say, what I found very interesting is how at some point it felt like I have to actually become a plant to learn from the other plants, or am I going too far now?
Yes.
I go too far.
In our work, we are trying really to explore like different ways of thinking and interacting with each other and plants. Our project is quite experimental. What we observed that, especially in Belgian society, healthcare system is very hierarchical and experts driven, and other types of knowledge like traditional Chinese medicine or herbalism, they exist, as you said, but still they are being ignored largely. And even in conventional healthcare system, we don't have good programs or good ways to document all these knowledges. So there's a lot of ways of taking care of health that is being hidden or unseen or ignored. And we think that this hierarchy is really not good for our cities and personal health resilience, that we really are searching for this dialogue, how to co-create together, how to make the dialogue of all these types of knowledges without really empowering some and looking down to others. So we also found that nature environment is very supporting in this process. And we see that also herbal medicine or traditional medicines, they are also not forever. They are also very much linked to richness of biodiversity, to richness of species. And as we're losing constantly this diversity of plants, we are also losing knowledge. So we really think that we have to give much more space for nature itself, because it became really a resource. The language we developed is very technical, and we as humans place ourselves in very hierarchical positions, speaking of nature and of plants. And we're also aiming for this shift in way of thinking and communicating with plants and with each other. Yeah. And we think that gardens are really good places to a little bit lower these tensions, those conflicts. And when we go into nature, it's easier to dialogue. And we see that this diversity of life, diversity of species, is very interrelated, and everyone has to say. Even plants, they have to say. Now there's a lot of research on plant intelligence, and we see that in our human imagination we become very limited, because as it was said yesterday and in keynote speech, it's very hard to find solutions in the same way of thinking how we created problems. And our imagination also has own limits. And if we want to foster this imagination, I think we have also to engage in collaboration and work with other species, including plants, and looking for ways how we listen them and how we give space for plants to express the intelligence.
Yeah, no, that's fascinating. There is a Dutch professor of philosophy who has dedicated the last 20 years of his life on an arboretum, where he has actually published about the consciousness that exists at the root level of plants, where there is the system that a garden or any kind of natural biosphere has an actual consciousness. And he said it's not a different type of consciousness, perhaps it's a different kind of consciousness than human beings, but human beings should not think that they are the only ones that have a certain level of consciousness, which makes you think that in your three presentations, that level of consciousness, there are two questions that I want to ask. On the one hand, if you think about what goes on in those communities, and there is both a sense of activism, of doing something, and there's also a sense of threat. Now, there is a lot of talk these days about development of new ways to look at mental health. If I think of your three things, one of the best solutions for a threat is to not be either frightened and run away, or to fight, or to freeze. The best way is to take action and react. That's my first question. Any reactions to that? Is there, at a conscious or even subconscious level, do people, have you related in any sense to psychosocial elements, people being stressed, people want to escape from that stress and successfully do so by taking action?
Can I get the floor?
Please.
Rhoda and then Jorge, yes, please.
Yeah, for indigenous communities, you know, the rituals, the community rituals are viewed as form of psychosocial processing. But what our CBHP program has introduced is to introduce this modern way of psychosocial processing, of like letting those, even in indigenous communities, especially in a very militarized situation, we are also experiencing this mental health problems, mental health conditions. So we have taken the view of looking at these indigenous rituals as some sort of community processing. The introduction of this modern way of processing, like encouraging those experiencing mental health conditions to speak, to say their piece, and then people trying to say their comfort, has contributed in our experience. So interfacing rituals with this modern way of social processing has contributed in dealing with mental health conditions of less, of course, those less severe ones.
No, great.
Thank you.
Thank you, Jorge.
Our experience in Mozambique, first of all, women and men adapt differently to the impact of climate change. You know, shows that women are more vulnerable to climate risk because they have few economic resources, less access to services and information, and less political power than men. This also means that women have a fewer means and resources to withstand climate shock. So you'll find more mental health be a burden in women in the community. So because of lack of resources, you will find us that they will invest in the resilience products or services, training, you know, or technology. But because of lack of resources, you will see that there will be less community support to the mental health problems that result from disasters. But on the other hand, we find out that even when we understand that the research shows that women have less power, have a less resource to on a resilience, but also women are the ones who have ability to be effective on mobilizing community to prevent further disasters on climate events. You know, the women are the ones who share more information related to community well-being in terms of which material you can use, which is less polluting, the people who will share information on environmental change, who will keep family together, who will try to have a share resource to community, would be women who organize themselves to go to the hospitals and collect medicines. So in time of example of heavy rain, when the roads will be closed, they will still have access to those medicines, you know, for the kids. So what I want to say with that is that, you know, we have to understand that the impact of climate change, it is real, and it is difficult if we don't really look on power relations also on that, where the role of women in the community on response to the climate events. But also, I would like to mention that in Mozambique, for example, we train community leaders and others on how to identify those risks events, but also how to do referrals in case of mental health. It's not easy because, you know, you one of the biggest barriers to access to services that those women live in remote areas, you know, hard to reach. So how you do that? So those are really important questions.
Yeah.
Thank you.
Yeah. But and the thing is that if we try to look at those what we call mental health, the whole world is now crying after COVID. There is more need for mental health services. At the same time, we know that there will never be a delivery up to that level. And I think the most important thing is that we have to get away from the psychocentric idea of mental health and look at what these communities are doing, because I think that is a very important thing. The communities are threatened by climate change, and now the communities, as you presented, which I think is fantastic, take action and respond to that change, which is many times overproven the most effective way to deal with that kind of stress. So it's a fantastic way of making sure that you become not just vulnerable, passive, and frozen by all the fears that come up to you. But I think from these communities, we can learn how to mobilize those kind of resources that we need to strengthen this. A last thing that I want, based on the same metaphor of the plants, of the roots of the plants, if you think, Vitalia, of what you were explaining, how you can share knowledge in a different way, other types of knowledge that are also shared in a different way. If you look at your experience in Mozambique, Bangladesh, in Brussels, and in the Philippines, how do we let those roots grow between your different experiences? Would that be possible? Is there a way that we can share this type of knowledge with other communities so that we can learn from each other? Any ideas on that?
I think that what we share all in our work is really about trust in life and togetherness. Because if we speak about resilience, if we speak about safety, if we speak about action, it's all in relationships. And we really have to privilege and to create conditions that those relationships could be created and flourish. And how do we create these relationships? How we create the spaces in times of preparation for crisis? And indeed, how do we act all together when moments of crisis are coming? But we all know that the chance of survival is always bigger when there's communal action, when we can rely on each other, support each other, and also to share responsibilities. Because for me, the central element in our conference too, how do we continue to take care of this in these difficult times of enormous suffering, of enormous injustices, and all these tragic climate events? How do we remain still stable? And I think that this stability we really can find in this togetherness and tending our planet as a garden. I think we have to really see it in this way, that planet is the garden, and we all take care together to the extent we manage and share responsibilities, because otherwise it gets very heavy on shoulders of one person or of one system.
Absolutely. Nicolette, I think you want to share something with us.
Yeah, and it's linked into, we were earlier saying about sharing knowledge and you know, how we join together to think about communities in healthcare. And what we've seen with communities that over the years, that self-care is so important in healthcare. And we've seen it especially on family planning and safe abortion care, that actually communities already do a lot of self-care and don't, you know, have not been connected to health systems. And what we're doing now is to see how can we connect health systems to help communities to improve their self-care, to support the self-care that they need. So for example, we've been, of course, technologies have been very useful. Of course, for example, we've been working with using drones to get abortion pills to communities. We have all the mobile technologies. And so we actually do really have the capacity and the resources to go to these hard to reach areas and to support communities in the self-care that they like and they need. Of course, like George was earlier mentioning, it's okay, again, you know, who will prioritize those hard to reach areas, right? In the end, that's the political discussion, of course, is who will prioritize communities in the end, and especially the really remote communities. So that was just a little thing I want to say about self-care, because it's so important to communities.
Yeah. Yeah, and it sounds like a paradox, but self-care and community care go very much hand in hand, I think. You can't help others if you can't help yourself, and you need the community to help you. Well, anyway. My friends, I think we have used up our time, and we are going to be pushed out by the next subject, that is transformative policy. So we move from communities to policies, but we are the community group that hands up for strong community incentives. Wonderful, I think. Thank you very, very much for all your contributions. I hope I tried to include some of the questions from the audience. I hope I managed to do that. Thank you for this possibility to talk about working in communities. And thank you, Rhoda, Nicolette, Jorge, and Vitalia.
And thank you, Willem. You filled up your time very well. It was absolutely interesting.